Welcome to NSG 323, Midwifery 11, Prenatal Midwifery 11, Intrapartum or Perinatal Midwifery 1. Study Session 1, Diagnosis and Management of High-Risk Pregnancies. Introduction. The common signs and symptoms experienced by pregnant women who are experiencing abnormalities of early pregnancies and problems of pregnancies are numerous. You are likely to encounter patients with these common symptoms in your nursing practice on a regular basis. Therefore, the objective of this study session is to assist you to understand how these conditions occur and your specific roles in helping patients who are experiencing such symptoms throughout the continuum of health care. Learning outcomes. At the end of this study session, you should be able to define high-risk pregnancy, enumerate the different factors that can lead to high-risk pregnancy, explain how these factors can be controlled, list the necessary investigations to confirm the condition, discuss how to promote a healthy pregnancy. 1.1 Definition of high-risk pregnancy. A high-risk pregnancy is a pregnancy that might pose challenges before, during, or after delivery. When a woman has a high-risk pregnancy, the woman and her baby might need special monitoring or care throughout the pregnancy. A high-risk pregnancy can simply be defined as the pregnancy that threatens the health or life of the mother or her fetus. Sometimes, a high-risk pregnancy is the result of a medical condition present before pregnancy. In other cases, a medical condition that develops during pregnancy for either the mother or baby causes a pregnancy to become high risk. 1.2 Factors that might contribute to a high-risk pregnancy. There are lots of factors that contribute to high-risk pregnancy, and among them are high blood pressure, polycystic ovarian syndrome, diabetes, kidney disease, autoimmune disease, thyroid disease, infertility, obesity, HIV/AIDS. High blood pressure. Even though high blood pressure can be risky for mother and fetus, many women with high blood pressure have healthy pregnancies and healthy children. Uncontrolled high blood pressure, however, can lead to damage to the mother's kidneys and increases the risks for low birth weight or preeclampsia. Polycystic ovarian syndrome. This is a disorder that can interfere with a woman's ability to get and stay pregnant. Polycystic ovarian syndrome, as displayed in Figure 1, may result in higher rates of miscarriage, the spontaneous loss of the fetus before 20 weeks of pregnancy, gestational diabetes, preeclampsia, and premature delivery. Diabetes. It is important for women with diabetes to manage their blood sugar levels before getting pregnant. High blood sugar levels can cause birth defects during the first few weeks of pregnancy, often before women even know they are pregnant. Controlling blood sugar levels and taking a multivitamin with 40 micrograms of folic acid every day can help reduce this risk. Kidney disease. Women with kidney disease often have difficulty getting pregnant, and any pregnancy is at significant risk for miscarriage. Pregnant women with kidney disease require additional treatment, changes in diet and medication, and frequent visits to their healthcare provider. Autoimmune disease. Autoimmune diseases include conditions such as lupus and multiple sclerosis. Some autoimmune diseases increase a woman's risk for problems during pregnancy. For example, lupus can increase the risk of preterm birth and stillbirth. Some women may find that their symptoms improve during pregnancy, while others experience flare-ups and other challenges. Certain medications to treat these diseases may be harmful to the fetus as well. Thyroid disease. Uncontrolled thyroid disease, such as an overactive or underactive thyroid, can cause problems for the fetus, such as heart failure, poor weight gain, and birth defects. Infertility. Several studies have found that women who take drugs that increase the chances of pregnancy are significantly more likely to have pregnancy complications than those who get pregnant without assistance. These complications often involve the placenta and vaginal bleeding. Obesity. Obesity can make a pregnancy more difficult, increasing a woman's chance of developing diabetes during pregnancy, which can contribute to difficult birth. On the other hand, some women weigh too little for their own health and the health of their growing fetus. In 2009, the Institute of Medicine updated its recommendations on how much weight to gain during pregnancy. New recommendations issued by the American College of Obstetricians and Gynecologists suggest that overweight and obese women may be able to gain even less than what is recommended and still have a healthy infant. HIV/AIDS. HIV/AIDS damages cells of the immune system, making it difficult to fight infections and certain cancers. Women can pass the virus to their fetus during pregnancy. Transmission also can occur during labor and giving birth, or through breastfeeding. Fortunately, effective treatment exists to reduce the spread of HIV from the mother to her fetus, newborn, or infant. Women with very low viral loads may be able to have a vaginal delivery with a low risk of transmission. An option for pregnant women with higher viral loads is a cesarean delivery, which reduces the risk of passing HIV to the infant during labor and delivery. Early and regular prenatal care is important. Women who take medication to treat their HIV and have a cesarean delivery can reduce the risk of transmission to 2%. Other factors that may cause high-risk pregnancy. Teen pregnancy, first-time pregnancy after age 35. Teen pregnancy. Pregnant teens are more likely to develop high blood pressure and anemia, lack of healthy red blood cells, and go into labor earlier than women who are older. Teens also may be exposed to a sexually transmitted disease or infection that could affect their pregnancy. Teens may be less likely to get prenatal care or to make ongoing appointments with healthcare providers during the pregnancy to evaluate risk, ensure they are staying healthy, and understand what medications and drugs they can use. First-time pregnancy after age 35. Older first-time mothers may have normal pregnancies, but research indicates that these women are at increased risk of having a cesarean delivery, delivery complications, including excessive bleeding during labor, prolonged labor lasting more than 20 hours, labor that does not advance, and infants with a genetic disorder such as Down syndrome. Alcohol use. Alcohol consumed during pregnancy, as shown in Figure 4, passes directly to the fetus through the umbilical cord. The Centers for Disease Control and Prevention recommend that women avoid alcoholic beverages during pregnancy or when they are trying to get pregnant. During pregnancy, women who drink are more likely to have a miscarriage or stillbirth. Other risks to the fetus include a higher chance of having birth defects and fetal alcohol spectrum disorder (FASD). FASD is the technical name for the group of fetal disorders that have been associated with drinking alcohol during pregnancy. It causes abnormal facial features, short stature, and low body weight, hyperactivity disorder, intellectual disabilities, and vision or hearing problems. Cigarette smoking. Smoking during pregnancy puts the fetus at risk for preterm birth, certain birth defects, and sudden infant death syndrome. Secondhand smoke also puts a woman and a developing fetus at increased risk for health problems. Conditions for pregnancy: multiple gestation, gestational diabetes, preeclampsia and eclampsia. Multiple gestation. Pregnancy with twins, triplets, or more, referred to as a multiple gestation, increases the risk of infants being born prematurely before 37 weeks of pregnancy. Having infants after age 30 and taking fertility drugs both have been associated with multiple birth. Having 3 or more infants increases the chance that a woman will need to have the infants delivered by cesarean section. Twins and triplets are more likely to be smaller for their size than infants of single-term birth. If infants of multiple gestation are born prematurely, they are more likely to have difficulty breathing. Gestational diabetes. This is also known as gestational diabetes mellitus, GDM, or diabetes during pregnancy. It's diabetes that first develops when a woman is pregnant. Many women can have healthy pregnancies if they manage their diabetes following a diet and treatment plan for their healthcare provider. Uncontrolled gestational diabetes increases the risks for preterm labor and delivery, preeclampsia, and high blood pressure. Preeclampsia and eclampsia. Preeclampsia is a syndrome marked by a sudden increase in the blood pressure of a pregnant woman after the 20th week of pregnancy. It can affect the mother's kidneys, liver, and brain. When left untreated, the condition can be fatal for the mother and/or the fetus and result in long-term health problems. Eclampsia is a more severe form of preeclampsia marked by seizures and coma in the mother. Eat a healthy diet. During pregnancy, the woman needs more folic acid, calcium, iron, and other essential nutrients. A daily prenatal vitamin can help fill any gaps. Consult the healthcare provider if there is a special nutrition need due to a health condition such as diabetes. Gain weight wisely. Gaining the right amount of weight can support the baby's health and make it easier to shed the extra pounds after delivery. A weight gain of about 11 to 16 kilograms is often recommended for women who have a healthy weight before pregnancy. If the woman is overweight before conception, she might need to gain less weight. If she is carrying twins or triplets, she might need to gain more weight. Work with the healthcare provider to determine what is right for you. Avoid risky substances. If the woman smokes, there is need to quit smoking. Alcohol and illegal drugs are off limits too. The pregnant woman should get the healthcare provider's consent before taking any medication or supplements. 1.4. Necessary investigation to confirm high-risk pregnancy. Investigations. If a woman reports with a high-risk pregnancy, there may be need to consider various tests or procedures in addition to routine prenatal screening tests. Depending on the circumstances, the healthcare provider might recommend specialized targeted ultrasound, amniocentesis, chorionic villus sampling (CVS), cardiosynthesis, cervical length measurement, lab test, biophysical profile, specialized or targeted ultrasound. This type of fetal ultrasound, an imaging technique that uses high-frequency sound waves to produce images of a baby in the uterus, targets a suspected problem such as abnormal development. Amniocentesis. During this procedure, a sample of the fluid that surrounds and protects a baby during pregnancy, amniotic fluid, is withdrawn from the uterus, typically done after week 15 of pregnancy. Amniocentesis can identify certain genetic conditions as well as neural tube defects, serious abnormalities of the brain or spinal cord. Chorionic villus sampling (CVS). During this procedure, a sample of cells is removed from the placenta, typically done between weeks 10 and 12 of pregnancy. Chorionic villus sampling can identify certain genetic conditions. Conducentesis. This test, also known as percutaneous umbilical blood sampling, is a highly specialized prenatal test in which a fetal blood sample is removed from the umbilical cord, typically done after week 18 of pregnancy. The test can identify chromosomal conditions, blood disorders, and infections. Cervical length measurement. Your healthcare provider might use an ultrasound to measure the length of your cervix at prenatal appointments to determine if you are at risk of preterm labor. Some prenatal diagnostic tests, such as amniocentesis and chorionic villus sampling, carry a small risk of pregnancy loss. Ultimately, the decision to pursue prenatal testing is up to the pregnant women and the partner. Lab tests. Your healthcare provider might take a swab of your vaginal secretions to check for fetal fibronectin, a substance that acts like a glue between the fetal sac and the lining of the uterus. The presence of fetal fibronectin might be a sign of preterm labor. Biophysical profile. This prenatal test is used to check on a baby's well-being. The test combines fetal heart rate monitoring, non-stress test, and fetal ultrasound. Management of patients with high-risk pregnancies. The management of patients with high-risk pregnancies is highly individualized depending on what the client is presenting with and the factors that makes up pregnancy of a high risk. Some of these management methods include: be cautious when using assisted reproductive technology. Summary. At the end of the study session, you have learnt that the definition of high-risk pregnancy, the various factors that might contribute to high-risk pregnancy, the various methods or ways on how to promote a healthy pregnancy, all the necessary investigation that's needed be carried out in order to confirm patients with high-risk pregnancy, various management methods that can be carried out in order to care for patients with high-risk pregnancy. End of study session 1. Thanks for listening.